Let's begin with the basics. Serotonin, or 5-hydroxytryptamine, 5-HT, is a neurotransmitter, a chemical messenger that helps brain cells communicate. While it's often associated with mood and depression, serotonin is involved in much more, including digestion, sleep, and importantly, pain processing. In the context of migraine, serotonin plays a dual role. First, it helps regulate vascular tone, meaning it controls how blood vessels in the brain expand or contract. Second, it modulates the excitability of neurons involved in pain transmission, particularly in the trigeminal-vascular system. Here's the interesting part. Research shows that in the early stages of a migraine, serotonin levels in the brain drop sharply. This drop leads to vasodilation, or widening of blood vessels in the meninges, the outer layers of the brain where pain signals are generated. That vascular shift contributes to the throbbing pain often felt during a migraine. But serotonin's role doesn't stop there. It also helps modulate the release of CGRP, the inflammatory molecule we discussed in earlier series. Low serotonin may give CGRP more room to act, triggering inflammation, nerve sensitization, and prolonged pain. Serotonin is produced in several places, including the raphe nuclei in the brainstem and the gastrointestinal tract. In fact, about 90% of the body's serotonin is located in the gut, a fact that may help explain the common link between migraines and nausea. Understanding serotonin as more than a mood chemical is key. In migraine, it's a neurovascular regulator, shaping how your brain and blood vessels respond to changes, and setting the stage for either balance or chaos. To understand migraine pain, we must understand how serotonin interacts with your blood vessels, because this relationship lies at the heart of the migraine process. In simple terms, serotonin acts as a vascular regulator. It influences whether blood vessels constrict, tighten, or dilate, expand. And in the migraine brain, this balance is delicate, easily tipped toward dysfunction. During a normal day, serotonin maintains vascular tone by binding to specific receptors on the walls of blood vessels. When these receptors, such as 5-HT1B and 5-HT2, are activated, they cause the vessels to constrict slightly, helping control blood pressure and circulation. This keeps blood flow stable, especially in the brain, which is highly sensitive to changes. However, in the hours leading up to a migraine, serotonin levels begin to drop sharply. Scientists believe this drop causes a rebound dilation of blood vessels in the meninges, the outer layers of the brain. This dilation stretches the vessel walls and activates nearby pain-sensitive neurons in the trigeminal-vascular system. That's the source of the throbbing, pulsating pain so many migraine patients describe, because those blood vessels are literally pulsing with each heartbeat, and the neurons surrounding them aren't just noticing the change, they're amplifying the signal. Worse still, this vascular instability may trigger the release of CGRP, a powerful inflammatory neuropeptide, which further irritates blood vessels and magnifies the pain. This cascade, low serotonin, vasodilation, CGRP release, is now understood as one of the core pathways of migraine. Interestingly, this is exactly where triptan medications work. These drugs act as serotonin agonists, meaning they bind to the same receptors serotonin would and help restore vascular tone. By causing constriction of those overdilated vessels and reducing neuroinflammation, triptans can abort an attack in progress, if taken early enough. We've discussed how serotonin affects blood vessels, but its role in pain perception is just as critical. You see, serotonin doesn't only act on the outside of blood vessels. It also shapes how the brain interprets pain signals through its influence on central nervous system pathways. That's where things get even more interesting. Deep inside your brainstem lies a region called the periaqueductal gray, PAG. It's one of the key players in pain modulation, often referred to as part of the brain's pain gate. This area communicates with other regions like the thalamus and spinal trigeminal nucleus, helping to decide which signals are allowed to reach your conscious awareness and which are blocked. Serotonin helps regulate this gate. When serotonin levels are optimal, they inhibit the transmission of pain, preventing minor discomforts from becoming full-blown pain experiences. But when serotonin drops, as it often does in the early phase of a migraine, this inhibitory effect weakens. The gate opens too wide, allowing pain signals to flood through unchecked. The result? Hyperalgesia, or increased sensitivity to pain. Things that wouldn't normally hurt, like a soft pillow, gentle light, or everyday sound, become overwhelming. This is why people with migraines often seek total darkness and silence. Their brains are no longer filtering sensory input properly. Additionally, serotonin interacts with endogenous opioids, your body's natural painkillers. Low serotonin levels may blunt this system, making pain feel sharper, longer lasting, and harder to treat. That's not just discomfort, that's altered neurochemistry. This is also why depression and migraine often go hand in hand. When serotonin levels are chronically low, the brain becomes not only more sensitive to emotional stress, but also to physical pain. It's a two-way street, with one condition amplifying the other. So when we treat migraines, we're not just targeting blood vessels. We're also addressing the brain's pain processing circuitry. Medications that restore serotonin balance, like triptans or certain antidepressants, can help recalibrate this gate and reduce attack frequency and severity. Have you ever noticed that your migraines seem worse when you're stressed, anxious, or feeling low? You're not imagining it. There's a deeply rooted biological link between mood, stress, and migraines, and serotonin is at the center of it all. Serotonin is famously known as the feel-good neurotransmitter because it plays a major role in regulating mood, anxiety, and emotional stability. But for people with migraine, it also helps determine how stress impacts the brain and how vulnerable you are to pain. Let's break it down. When you experience chronic stress, your body releases cortisol, the primary stress hormone. Over time, high cortisol levels reduce serotonin availability in the brain. Less serotonin means reduced ability to regulate both emotions and pain signals, making you more sensitive to both physical discomfort and emotional strain. This is one reason why anxiety and depression are far more common in people with migraine. It's not just about the burden of living with pain, it's also about shared neurochemical imbalances. Studies show that migraine and mood disorders often co-occur, with serotonin dysfunction being a common thread. Even more interesting, emotional triggers such as conflict, grief, or anticipation can lead to pre-migraine warning symptoms like irritability or low mood. These aren't side effects of the pain. They may be early signs of the attack itself, caused by the same chemical shifts that eventually trigger the headache. Managing stress is therefore critical in managing migraines. But it's not just about staying calm, it's about protecting your serotonin balance. Techniques like mindfulness, cognitive behavioral therapy, and regular sleep have been shown to reduce the frequency and intensity of migraines by supporting healthier serotonin regulation. Some physicians even prescribe serotonin-boosting medications like SNRIs or tricyclic antidepressants, not primarily for mood, but as a way to stabilize the migraine brain. The goal isn't to sedate or suppress symptoms, but to reset the neurochemical environment so it's less reactive to daily stressors. When you think of serotonin, you probably imagine the brain. But here's something most people don't know. Around 90% of your body's serotonin is actually produced in the gut. That's right. The majority of this crucial neurotransmitter is synthesized by enterochromaffin cells lining your digestive tract, not your brain. This surprising fact opens up a new dimension in migraine science, one centered on the gut-brain axis, the two-way communication network between your gastrointestinal system and central nervous system. And serotonin is a key messenger in this link. Let's unpack how this affects migraines. First, many people with migraine also experience gastrointestinal symptoms: nausea, vomiting, bloating, constipation, or diarrhea. These aren't random, they're part of the migraine process. During an attack, serotonin levels fluctuate not just in the brain, but also in the gut, causing abnormal contractions, slowed gastric emptying, and hypersensitivity in the digestive tract. Second, disruptions in your gut, whether from diet, illness, or chronic inflammation, can affect serotonin production. A disturbed gut microbiome, the balance of bacteria in your intestines, can impair serotonin synthesis, increasing vulnerability to both migraine and mood disorders. Inflammatory signals from the gut may also sensitize the vagus nerve, which connects the gut and brain, further amplifying headache risk. This explains why migraines often accompany irritable bowel syndrome, IBS, and why dietary changes can have such a profound effect. A high-sugar, low-fiber diet can throw off gut flora and serotonin balance, while probiotic-rich foods and anti-inflammatory nutrients may help regulate both. Even stress impacts the gut. When you're anxious, blood flow shifts away from digestion, disrupting gut motility and serotonin levels. So again, we return to that core message. Stress, mood, and migraine are all chemically linked, and the gut plays a surprisingly central role. Managing migraines means thinking beyond the brain. A healthy gut, supported by balanced nutrition, regular meals, hydration, and fiber, may be one of the most overlooked tools for supporting serotonin and reducing migraine frequency. By now, you understand that serotonin plays a central role in migraine, from regulating blood vessel tone to filtering pain signals. So it makes sense that some of our most effective migraine medications work by targeting serotonin itself. Let's take a closer look at how. First up, triptans. These are one of the most widely prescribed acute treatments for migraine, and they work by mimicking serotonin at specific receptors, especially 5-HT1B and 5-HT1D. When these receptors are activated, triptans cause blood vessels in the brain to constrict, reducing the throbbing dilation that contributes to pain. They also inhibit the release of CGRP, blocking the inflammatory cascade that amplifies migraine symptoms. For many patients, taking a triptan early, at the first sign of headache or aura, can abort the migraine entirely. However, they must be used with caution, especially in people with heart disease or high blood pressure, because they constrict blood vessels systemically, not just in the brain. Then there are SSRIs, selective serotonin reuptake inhibitors, and SNRIs, serotonin norepinephrine reuptake inhibitors. While these are typically used as antidepressants, they also increase the availability of serotonin in the brain, and in some cases, this can reduce the frequency or severity of migraines, particularly in patients with coexisting anxiety or depression. But their role in migraine prevention is complex. These medications don't target the same receptors as triptans, and their effects may take weeks to appear. They're generally used for preventive purposes rather than for treating acute attacks. Another class includes TCAs, tricyclic antidepressants, like amitriptyline, which affect serotonin, norepinephrine, and other systems. They're often used off-label for migraine prevention, especially when patients also have sleep issues. The key takeaway? Not all serotonin-targeting medications are the same. They work at different receptor sites, with different mechanisms and timeframes. That's why one patient might respond well to a triptan, while another benefits more from a preventive antidepressant, or needs a combination approach. One of the biggest questions in migraine research isn't just how serotonin works, it's why its levels drop before an attack. The answer isn't simple, but science is starting to reveal patterns. Serotonin levels are influenced by many factors: sleep, stress, hormones, diet, and even light exposure. And in people with migraine, these systems tend to be more reactive. Let's begin with circadian rhythms, your body's internal clock. Serotonin is closely tied to melatonin, the hormone that regulates sleep-wake cycles. When your sleep is disrupted, whether due to insomnia, shift work, or even sleeping too much, serotonin production can become erratic. This can make the brain more vulnerable to both emotional instability and pain sensitization. Stress is another major player. When you're under prolonged psychological or physical stress, your body increases cortisol production. High cortisol levels, over time, can suppress serotonin synthesis. This helps explain why stress is not only a migraine trigger, but also a factor in low mood and sleep disturbance, creating a perfect storm for attacks. Hormonal fluctuations also play a role, especially estrogen. In women, a drop in estrogen during the menstrual cycle is often accompanied by a dip in serotonin. This hormonal serotonin link explains why menstrual migraines are so common and often more resistant to treatment. Your diet matters too. Serotonin is made from tryptophan, an amino acid found in protein-rich foods like turkey, eggs, and nuts. But tryptophan must compete with other amino acids to enter the brain, and it needs a steady supply of vitamin B6, magnesium, and complex carbohydrates to be properly converted. Skipping meals or consuming a high-sugar, low-nutrient diet can throw off this balance. So how do you stabilize serotonin? Start by prioritizing sleep, reducing stress through mindfulness or therapy, and eating regularly with a focus on whole foods. Moderate aerobic exercise is also a natural serotonin booster. Just 30 minutes of brisk walking can elevate levels and protect against drops. Understanding what destabilizes serotonin in your own life allows you to reduce not only migraines, but also the mood swings, fatigue, and hypersensitivity that often go with them. For decades, the dominant theory in migraine treatment was simple. Migraine equals low serotonin, so we treat it by increasing serotonin. It was the basis for triptans, for using antidepressants off-label, and even for linking migraine to mood disorders. But as science has advanced, we've discovered that serotonin is only part of the story. Here's what we now understand. Migraine is a multifactorial neurological disorder. Yes, serotonin plays a critical role in regulating blood vessels and pain, but it doesn't act alone. Other players, like CGRP, calcitonin gene-related peptide, glutamate, dopamine, and inflammatory cytokines, also contribute to the cascade that causes a migraine attack. That's why serotonin-based medications don't work for everyone. In fact, up to 40% of patients don't respond to triptans. Others experience side effects, like tightness in the chest, fatigue, or even rebound headaches, especially with overuse. Some people don't have low serotonin levels at all. In some cases, it's how serotonin receptors function that matters more than the absolute amount. You could have normal serotonin but still experience migraines due to receptor sensitivity, distribution, or crosstalk with other neurotransmitters. And then there's the timing issue. By the time a migraine is in full swing, serotonin might no longer be the dominant factor. At that point, other systems, like CGRP and neuroinflammation, are driving the pain. That's why newer treatments focus on these non-serotonergic pathways, offering relief even when traditional drugs fail. Some of these newer therapies include GPANTs, CGRP receptor antagonists, ditans, which target 5-HT1F receptors instead of the traditional 5-HT1B11D, and monoclonal antibodies that block CGRP long-term for prevention. These don't rely on serotonin, and they're offering hope to patients who previously had few options. The bottom line, serotonin is crucial, but not universal. Migraine treatment is becoming more personalized, and understanding your brain's individual chemistry is key to finding what works best for you. Now that we've explored serotonin's role in migraine, from blood vessel control to pain modulation and emotional balance, it's clear that treating migraine isn't about one chemical or one cure. It's about understanding how your unique brain responds to a wide range of internal and external factors, and building a personalized plan around that. Serotonin is part of the puzzle, but so is CGRP, glutamate, dopamine, stress, sleep, hormones, and gut health. Each of these influences the brain's excitability and how easily it can tip into a migraine. That's why two people with the same diagnosis might respond very differently to the same medication. Personalized migraine care starts with self-awareness. Keep a detailed migraine diary, tracking your sleep, stress, diet, hormonal cycle, and environmental exposures. Note how you feel emotionally in the days before an attack. Look for patterns. You're not just logging headaches, you're decoding your brain. Next, work with a provider who understands the full scope of migraine. Some patients benefit from triptans, others from CGRP blockers or serotonin-modulating antidepressants. For some, non-drug strategies like CBT, mindfulness, magnesium, riboflavin, or acupuncture play an important role. Lifestyle changes matter. Prioritize regular meals, hydration, and consistent sleep. Manage stress not just reactively, but proactively. Small habits, like winding down before bed or stepping outside during the day, support serotonin balance, and help regulate your internal clock. Most importantly, don't let migraine define you. It's a medical condition, not a personal failure. By learning how your brain chemistry responds to change, you gain real power, not just to treat migraines, but to reduce their frequency, intensity, and impact. Science is catching up to what many patients have long known. Migraine is real, complex, and treatable, with the right knowledge and the right plan. Thank you for joining this journey. You've just taken a major step toward understanding your migraine brain and reclaiming control.